Welcome to the webinar on the World Report on Vision. My name is Johannes Trimmel and I'm the interim CEO of IPP. So I should say good afternoon, but at the same time, looking at the list of attendees, also good morning and good late evening or good night nearly. So we have a good mix across continents for this webinar. The webinar is really meant to kind of provide you with an overview on where we stand with the World Report on Vision, what's the process so far, what will be mainly covered in the World Report, what are the key concepts behind, and what are the next steps up to the launch that's planned for the World Sight Day. I'm very happy to have Megan McCoy with us from WHO, who is the lead in working on developing and writing the World Report on Vision, and she will kind of run us through a presentation around the issues I just mentioned. We have set up the webinar in a way that there's a the presentation of Megan is given in sections, and after each section, there's a chance to kind of deal with questions you may have that came up during the presentation. If you have questions coming up or comments, then please put them into the question box. So if you look at your right-hand panel, you have a couple of gray lines with different headlines like sharing, audio, dashboard, and so on. And you have one that's called questions. And if you if you click on the arrow there, the window opens and you can put in your questions there. And what I will try to do is that after each of the sections, I'm trying to kind of summarize a bit the questions and ask them to Megan so that she can address them. If you have any other issues on connectivity and so on, please also put them in the text box, and we will try to address and solve them as quickly as possible. And with that, without further delay, I will hand the word to you, Megan, to start with your presentation.
Great, thank you very much, Johannes, and thank you everyone for joining today. So the presentation today, I'll just make sure, sorry, the presentation today, we've got 4 sections. So firstly, looking at what is the process around developing the report, then an overview of what's in the current draft, then we'll move on to pulling out some of the key concepts and proposals that are in the report, and then finally finishing on what happens around the launch. So firstly, around the process to develop the report, I'll cover a little bit about the why are we doing this, who is it for, how is it developed, what happens next, those sorts of things. So why is WHO doing a world report on vision? Well, we're doing it to try and achieve change. World reports from the WHO perspective can be really powerful tools to shift the way we think about particular issues. They bring together a wide range of evidence from a public health perspective. They're also quite valuable in providing a guiding framework for how countries seek to address particular topics. While they are a powerful tool for a change, they're not a silver bullet. We know that they are only one thing out of many that needs to be done. But nevertheless, we feel this report can be really useful for the future of eye care. Why are we doing this report now? Well, I guess sort of from our perspective, we think that while there has been a great deal of success in the field of vision over the last sort of 20-30 years, there's still much more to be done, and in particular there's 2 things that are really driving this. Firstly, even though the prevalence of vision impairment is decreasing, the number of people affected is increasing and is set to increase quite significantly. Also, the content context in which eye care services are being delivered is changing, with countries moving towards delivering on the Sustainable Development Goals. Another reason why this report is quite important is because the current Global Action Plan is due to finish in 2019, as you all know. At this stage, there is, from the Secretariat's perspective, no further plans to have a new Global Action Plan. This is really in line with WHO's new global program of work and wanting to make sure we're focusing more squarely on delivering change and achieving impact at the national level. This is all still to be confirmed. However, of course, we're an organisation made up of member states, and countries may indeed request another global action plan. At this stage, though, we see this World Report on Vision as providing the new strategic framework for eye care for the next 10 years. So who is the report for? Well, it's really for a wide range of stakeholders. We need to be clear up front and say that we're not necessarily expecting everyone to read the report or the full detailed report as much as we might like them to. What we're trying to do is to make sure that there is content in the report that is relevant to a wide range of stakeholders, and then how we use that content and how we communicate it is a bit different. So we have governments, obviously, are one of the key stakeholders for this, obviously ministries of health, but also other ministries such as education or finance that do have a role to play in the delivery of eye care services. We have NGOs, again, those focused on eye care, but there are also other NGOs working in other areas of health or in education who we think should find this report and the content of relevance to their work. And academia as well, those in eye care, but also in other areas such as statistics and human resources, and then of course multilateral agencies and the private sector. So really we have different groups of stakeholders, and they can be almost divided into two, those within the eye care sector and those from outside, and we're trying to make sure that the content in the report is relevant to all of those different groups. How is the report developed? So the process has been ongoing for about a year now, maybe a bit longer, and really the steps have been to develop a draft structure, what we think out of all of the potential issues that are important needed to go into the report. We did some early online consultation last year to ask people what they thought the key topics and issues were, and that was a helpful check-in process for us to make sure we had the right structure and the right content covered. We then commissioned some background papers and we developed the draft report on the basis of those papers. And this is the draft report that we are consulting on at the moment. What happens after the consultation period is that we will be analysing all of the feedback we get, and we will be looking at what changes we need to make to the content, to the structure. We expect that we'll need to be gathering new evidence, looking for new studies and research that we haven't yet cited, but we need to, making sure we have a really strong evidence base as a key element of WHO world reports. We'll then be going through quite a comprehensive peer review process to make sure that the findings and the recommendations are sound as well, and this will all happen before we go through the final WHO approvals process. Now, who is involved? Even though this is a WHO report, it's very much a collaborative effort. So we have an editorial committee. They have met twice so far and will meet another time to consider the draft report. That committee has given us advice on the structure and the draft and really providing a strategic direction. We also have an advisory committee, which is made up of representatives from some of the key organisations and also from outside the eye care sector as well. That the committee also provides high-level strategic and advice and is helping us around the political buy-in to the report. We have the authors of the background papers, the peer reviewers for the report, and of course a much, much wider group of stakeholders, including those of you participating in this webinar and who will hopefully provide feedback on this draft report. I'll pause there now for any questions around the process thus far.
Thank you, Megan, for this first section around the process. So far, we have one question that is about the selection of the peer reviewers. So how are peer reviewers selected?
We're still working through that process at the moment. We want to make sure that we've got people who have the right expertise for the different parts of the report or the report as a whole, as well as making sure we have good representation as well from different perspectives from right around the world. So that process has not yet finished, and we're waiting to see what comes through the consultation process to then know what changes we need to make to the report, and therefore what sort of peer review expertise we will need.
And there's a related or a follow-up question around who is authoring the report. So how are the authors selected, or how is it organized? Who writes actually things and who writes the report?
Yeah, so for this report we commissioned background papers, and we are writing, the report is being written internally on the basis of the information from those background papers, plus the consultation, plus the other work that we would do. The WHO has two different approaches to writing world reports. Sometimes we will commission an author or a group of authors to write entire chapters for us, and the other way we have of working is commissioning authors to write background papers, and then the report is written internally. We've decided to go for the background paper approach and writing the report internally here. Our experience across the department and across WHO shows that that's actually the most effective and efficient way of working, because it means we're not asking people outside WHO to try and write in a WHO style, but it still means we can draw on the best, kind of quality expertise and expert advice.
Okay, thank you. There's more detailed questions coming up, but I think we are tackling them when we are coming to next sections, because there will be also kind of information on content and topics and so on that's coming up. Maybe one last question from my side, or on the process. We are now in the consultation on the first draft, and I think many people attending the webinar have been submitted to previous consultations in various organizations and so on. In how far is what we see now as the first draft already a kind of pre-final version where it's kind of you put in a lot of things, but then in the end it doesn't change much, or in how far it's really work in progress that develops over the next weeks?
This is still a very draft report, so we didn't want to consult on something that we thought was a final version. We wanted to try and have the consultation happening early on so we could get some advice and guidance from stakeholders around the strategic direction and the content and the structure. So we're expecting that we will get lots of feedback, and we'll need to consider all of that feedback, and we're expecting that we will need to make quite a few changes to the report. So we definitely don't see this as the final version. This is really a version that we wanted to try and get some of the key points in, but then to ask people what they think, and to test the ideas and the thinking in it.
Okay, I think with that encouragement to really contribute, we can go to the next section around the overview of the report.
Sure. So the overview. So this is really a report in two halves. The first half of the report is dedicated to describing essentially the current situation and some of the history, what's worked, what hasn't, what are some of the remaining gaps. The second half of the report, so from chapter 4 onwards, then tries to set out what we think the strategic direction should look like. So chapter 1 is around the understanding of vision, and really the content in this particular chapter is not necessarily for the eye care sector. It's for those other people outside the eye care sector who may be making decisions relevant to eye care, such as ministers of health or other senior people who really might not have as in-depth understanding of vision and eye care as what people in the sector obviously do. So we're wanting to introduce some of the key terms so that we have a clear understanding right from the very beginning. And of course, we'll be explaining terms as we use them, and we will have a comprehensive glossary at the back. This part of the report is also aimed at trying to get people to think about what vision looks like from an individual's perspective. It's often not something that people think about, particularly if they're not working in the eye care sector. And so this section is really sort of focused around that. Another issue is around the vision problems and vision impairment. And we're wanting to sort of emphasise that vision impairment is obviously a critically important focus, but that in day-to-day life, there are many more people who experience different problems related to vision. They present to facilities, they access services, and we need to think more broadly about what those situations might be for people. Chapter 2 then presents the global situation, so drawing on global data and global information. The first part is around those eye diseases, and that relates to what I was just talking before about vision problems are broader than impairment. We want to try and emphasise the full range of morbidity associated with eye diseases. This part of the current draft report is very short. It's still very much a work in progress. The next section around vision impairment prevalence draws on some of the recent estimates last year and from the Vision Loss Expert Group and the courses paper. And really the key messages there are, as I mentioned before, that prevalence is decreasing, but the number of people affected is increasing and is projected to triple by 2050. We're also emphasising that there's a close correlation, obviously, between ageing and population growth, and trying to make the point that while there's lots of great work happening, there's a concern that we're not keeping up with the demand and the projected demand in future. We're also trying to look at 3 different topics within this around vision impairment, obviously ageing, also around poverty and development status of countries and of individual situations as well, and then of course the link with gender. The final part of this report is really aimed at the decision makers, the people who are responsible for making decisions about how much funding eye care receives. And essentially we're trying to make the case in this section around what happens if we don't invest in vision. We know that their vision and some interventions in particular offer a really good return on investment. How can we bring together a really strong economic case? And then finally, we have the contribution that vision makes to the SDGs in trying to expand this understanding beyond simply the goals around health. Chapter 3 then looks at some of the global responses and the lessons learned. The first section here is around addressing the common causes of vision loss, and this has been separated into 3 subsections. The first one is looking at the progress around those diseases that can be entirely prevented, and there is a great deal of success, particularly around things like trachoma and onco, but yet there is still more to be done. There's also been, there is a group of, as well around those diseases that can be treated to restore vision, and obviously looking at the, the significant improvements around cataract surgical coverage, also looking at the increasing profile around uncorrected refractive area, but also that there is much more that needs to be done there. The final group is around those diseases where early detection and ongoing treatment and management are incredibly important, the chronic diseases, and across all of these different subgroups, trying to emphasise what's worked and what are the remaining gaps. The second area there is around the disease-specific programs, and what we're trying to do here is to get across that in some instances, programs that focus specifically on preventing or treating one disease are the most effective and efficient way of delivering services that might not otherwise be provided. However, it is important to consider whether or not that is the appropriate solution in every setting, and whether or not the opportunities to provide a wider range of services are being re-evaluated over time as well. Disease-specific programs can be integrated into existing service delivery standalone, delivered by government or delivered by others. The quality of care has been an important topic, but it is also one where there is increasing attention, but there's also a sense that we perhaps don't know enough about what is currently happening in this area in a comprehensive way. Often people say that, you know, in low and middle income countries, you know that the quality of care is not so good when people stop accessing services because they've heard about someone who's had a poor outcome, for example, the word of mouth type thing. Access to services, again, is another area, looking at the availability, affordability and acceptability, etc. This is where we're really wanting to highlight equity as a major area of concern. Services more generally have expanded, which is great, but what we are seeing more now is that there are groups that remain underserved and that are not being reached as much as what they should do. I won't go into integration. That's the first concept that I wanted to talk through. The next ones there are around vision rehabilitation, wanting to emphasise that this is an area where there really has been, in most places, insufficient investment, and that often people with irreversible vision loss are told that there's nothing more that can be done, and this is really highlighting a significant gap. And then finally, in advocacy, looking at the work that has been achieved to date at a global level with initiatives such as Vision 2020, for example, and then also obviously World Sight Day at a national level. Chapter 4, again, this is comprehensive eye care services, and we'll go into this one more in depth soon. Chapter 5 is then around the drivers of change. So this is trying to look at what's required from a health systems perspective to support comprehensive eye care services and the scale up of services in future. Planning will come to more under the integration concept. Looking at people-centred services there, this is particularly important around equity and reaching underserved groups. The priority package, I'll come back to that as well. Around human resources, some of the key messages there are around the importance of focusing on competencies required to deliver interventions and services, given that the cadres available differ quite considerably between countries. From a financing perspective, looking at what does it really mean for eye care to be included in existing financing mechanisms from procurement, human resources, infrastructure, etc. Also trying to look at where financing is not just from the current government sources, but also through health insurance schemes, as is in the case in some countries. Data and information is an important area, highlighting the importance of integration for eye care and a package of indicators into the health management information systems, noting that we need to do more around morbidity. There's been a great deal of improvement around data around vision impairment, but there is still more to be done. Some countries where we don't have any, where we might not have enough around subpopulation groups or the socioeconomic status of individuals. Under leadership and governance, this section is trying to highlight that there are a range of different approaches that can be used. In some countries, for example, the Prevention of Blindness Committee plays a leadership role in terms of governance and coordination as well, is really effective. In other countries, the national professional associations help to fill those functions. Obviously, focal points in ministries of health is a considerable variety of experience in terms of how focal points roll, and also recognising that in some countries it just takes an individual champion as well to sort of progress the issues. The equipment, medicines and consumables section there, part of that is highlighting some of the essential lists that already exist, and we need to do more around how we sort of draw attention to those and ensure that they can be used as widely as possible. The final section in this chapter is around disability inclusive development, and what we're wanting to do there is to essentially say that even if the health system is able and other systems are able to deliver really good quality comprehensive eye care services, including vision rehabilitation, that there's more that needs to be done in other sectors through policy change, through delivery of different supports and services, breaking down other barriers in employment and education for people with vision impairment to be able to participate in their communities and in society on an equal basis with others. And then finally, Chapter 6, the agenda for action. This has, at a high level, what we think the recommendations should be. We need to expand on these. They cover some of the topics that I've already mentioned, and we'll cover some of the key, there are some key concepts in here that I wanted to pull out as well. So I might just pause there for questions.
Thank you, Megan. Again, reminding people, if you have questions, please put them into the questions section that you find on your panel on the right side of the screen, and you just put the arrow and then the tab questions opens. I have one specific question around whether corneal blindness is a point of interest for the report. It's a very specific issue.
I'm trying to think if we have that specifically referenced at the moment. I'm not sure that we do, but if it is something that people feel is important, I would encourage you to write that down and to submit that as feedback as well. As I said, this is still a draft, and this is for us the purpose of consultation is to get that feedback.
And the more general question and point of interest is there's the assessment that usually if WHO publishes reports and so on, they are very much focused and targeted on governments and especially Ministry of Health. And if your presentation kind of indicated that this report is definitely also kind of targeting all stakeholders, so including civil society and NGOs and the private sector. So first of all, is that right? And secondly, does that mean if somebody kind of wants to contribute with good practice or suggestions on how to develop sustainable models of eye care, that such examples could come from all stakeholders, or is that limited more to kind of government policies and so on? And maybe, Megan, you can also say something about providing case studies and what's the best system to do that?
Yeah, sure. This report is definitely aimed at a wide range of stakeholders. We want to make sure that it has a framework and guidance that is useful for countries, for governments. But we also know that there are many different groups of stakeholders who are involved in all aspects of the delivery of eye care services, including from an advocacy perspective. Some countries also outsource service delivery to public, not-for-profit organisations or for-profit sectors as well. So very much this report has a wide range of stakeholders where we're trying to aim the content for. In terms of case studies, in the draft report, we have some placeholders where we think we need to add case studies to help illustrate or explain particular concepts or points that we'd like to make. We're expecting that that list will change and grow following the consultation and based on the feedback we get from people. We will not be calling for case studies for this report because we need to really make sure we're getting what we need for the report. So we want to see what comes through consultation first, and then to see what are the most important topics where a case study would be useful. And also the types of case studies we'll look for will depend on you know, whether we need something that's regional or country or local, or is it a short one or a long one. Having said that, if people are reading through the report and they can see that we have a case study highlighted, or they can see some other areas where a case study would be useful, and you know of something, please make a note of it in your consultation feedback. Don't write it for us, because we will have specific templates and things that we might need to work through, but it would be really helpful actually if people could make a note so that we've got that and we can include that in the mix. That would be great.
Thank you. I'm trying to summarize some of the questions, and just also to make sure all the comments that you are making here will be made available also to Megan after the call, so that she can have a more in-depth look. There is a couple of questions around in how far is the report really trying to address systemic issues like policies that restrict or enable service delivery, about kind of addressing the issue of including eye care services in insurance program, insurance schemes, how to make sure that it's not just about blindness, but there's non-blinding conditions included. So what's the ambition of the report in these areas to really kind of talk to policies and systems?
Yeah, I would say our level of ambition is quite high around addressing, you know, those issues. Embarking on a world report for WHO is a major exercise, and we're doing this in a way that we hope will provide, you know, appropriate guidance on the topics that are of most importance around eye care, and you know, policy change, looking at the regulatory environment at the national level, and that it can be both a barrier and a facilitator of service delivery is important. Morbidity too, we also think that is important. So we have for ourselves, I think, a high level of ambition around what the report should aim to address, but we really encourage others, as you're reading the report, to give us feedback on that. If there are key topics that we've missed or aren't sufficiently highlighted, or we also want others to have, you know, a high degree of expectation of this report as well. And that's why we're encouraging as much feedback as possible.
That's good to hear. I give you a tricky one now. Somebody is saying that if you look at what people communicate about numbers and figures of people affected by vision impairment and by eye health problems, you find many different figures from 800 million to 2.5 billion and so on. What will the World Report on Vision do about that? Do we get a clear answer? What's the real number, and what are the differences in what is communicated?
Yeah, I think that is a real challenge, and it's something that we see as well, where there are different figures used in different places for different purposes, and sometimes because maybe people are using old figures and they might not know of new ones. At this stage, we're planning on drawing on the papers that were published in the Lancet last year and referring to those. Throughout the report, we want to try and make sure that whatever facts and figures we're using, we're referencing them, so that if there are some caveats to it, such as it might not include all different levels of vision impairment or all different diseases, those sorts of things. We need to be really, really careful about that. So if there are particular areas where there is perhaps confusion or different figures that are used, even including some feedback in the feedback template for chapter 2, which is on the global situation, would be really helpful, because it is one of the things a World Report can help to do, is to clarify particular issues and to be a reference document in that respect.
Okay, thank you. But I'm seeing now that there is 2 or 3 questions or comments that came around childhood blindness, also stating that that of course we not only have an aging population, but we also have an increasing rate of good child health, which means that children kind of survive who in earlier years would not have been survived and develop some eye problems and so on. I suggest that we take that up in the area of integration, because that also links to the connections we have outside the health system with other areas and sectors such as education and social sector and so on. And there was equally a question around human resources and continuous professional development for people working in their eye health. I think that may also come back under the comprehensive eye care services bit that's coming up. If it's not covered, I would ask people to kind of put in their question again, but suggest in the interest of the time that we go to the next section now. Megan?
Yeah, sure. So the first key concept that we wanted to talk through was integration. And the reason why we're wanting to pull this one out in particular is because it is such an important concept, but it's one that it seems there are differing views and perspectives on, and often because the term means different things to different people. So we wanted to describe 2 aspects to this in particular, integration around planning and integration around monitoring. And I'll describe what essentially the report is proposing on those 2 topics. So firstly, when it comes to planning, the report is trying to emphasise that eye care needs to be considered an integral part of the health sector strategic plan, and that this, of course, needs to be supporting the implementation of the national development plan in countries. We have this sort of health sector strategic plan in the middle there, and there are 4 circles around it: TB, HIV, eye care, and NCDs. These are just illustrative examples. What we're wanting to see here is that eye care is in an eye care plan is not seen as something that sits off to the side, that is not aligned, that is not integrated, but it is considered a core element of the health sector strategic plan. And this also includes, obviously, how eye care is included in other plans, such as eye care around neonatal services, or eye care around NCDs, and in particular diabetes. This is an area where we know there's been obviously lots and lots of work around developing eye care plans at the national level, but yet there seems to be in many places a disconnect between those plans and the way in which other health services are planned and designed and delivered, and obviously the funding of those services. The second aspect of integration that we're wanting to highlight is around monitoring and evaluation. It's obviously, a planning process is important in and of itself, but it is not enough. And we're wanting to highlight that there is more that needs to be done to monitor whether actions in plans, whether they're in a separate eye care plan or integrated in other plans, are actually being achieved, and whether or not the services that are being delivered are meeting the needs of people, including underserved groups. The report is proposing that there needs to be further work around monitoring and evaluation frameworks, and this diagram is an illustrative one, not intended to be an exact science, but essentially highlighting that there is information from inputs and processes, such as human resources, outputs, what's actually delivered, to also looking at what are the outcomes, what changes for people as a result of those services, and what impact does this have on their life. And there are different sources for this information, generally from admin data to facility to population-based surveys. What we're proposing is that monitoring and evaluation frameworks and processes, there needs to be increasing attention and effort on that. That does not necessarily mean, of course, that every country needs to have a plan that looks like this and is detailed and includes all of the information. It might be that some countries work towards improving perhaps one aspect of monitoring inputs or outputs as a progression towards better collecting, analysing and using information around service delivery to inform the next steps. So this is integration of eye care into the health management information systems and making sure that there are frameworks to support those. And I will pause there.
One point of information around, because there was the question on the availability of the PowerPoint. So this webinar is recorded and we will make the record available and also the PowerPoint. However, if you want to have it earlier than that, is if you look at the right-hand panel, you have one box where it says handouts. And if you click on the arrow, you will see a sign and it says webinar PowerPoint, and you can also download it from here, but we will make it available for everybody. The one question that came up, Megan, that I think is quite relevant is from the work you have done on the report so far on the background papers and input that you receive, is there any areas you have already identified where you say, well, that is really, we have lack of information here, we have lack of evidence, we don't feel confident to really put something together on the basis we have, where people could possibly kind of support to fill these gaps?
Yeah, I would say that probably off the top of my head, around from the systems perspective. So we're generally finding that it's easier to get information around from around clinical interventions, but looking for sort of health policy and systems research that looks at the sort of the building blocks of the health system around eye care, what works, what doesn't, what are those gaps. We're finding it more difficult to find published studies and also grey literature from that perspective. So if that's something that people have, that would be very useful as well. And also, just on this topic as well, to what degree have monitoring and evaluation frameworks or approaches been utilised to date, and what's been the experience, and or what have been some of the barriers, for example?
Maybe that's a good follow-up question. There's also a couple of people in the audience who are working on publications or kind of to do publications of articles and journals where there's already kind of things put together, for example, around equity and equal access and inclusion of usually left behind groups like persons with disabilities. Is this something where people should kind of write something up for the report, or is it better that they approach you, and I know you will share your email at the end of the presentation, and kind of say we can offer that so that you can decide on what's really kind of helpful for you to get into the report to avoid too much double work? What's a good approach here?
Yeah, if there's work that's in progress but it's not completed, please do send me an email and let me know, and then that way we can maybe sort of look together and work together at how we might be able to incorporate some of that. I'm loath to ask people to write things as well, because often what ends up in the report might only be a small fraction of that. But at the very least, putting it in the feedback template or sending me an email to let me know if there's something you've got that you think might be useful for the report, that would be great.
Okay, and a very practical question, which probably is a no-yes answer. Is it possible to share the background papers that were used to draft the World Report in the first place?
The papers have been really only put together for internal purposes only. So we did them so that we could specifically pull different pieces from them. However, I understand that many of the authors will be looking to publish versions of the papers elsewhere, perhaps in the bulletin or in other publications.
Okay, thank you. I think we should move to the next section on comprehensive eye care services.
Sure. So then this part, this is really when we start to go into what do we think the future should look like, and this report is saying that we think the future needs to be focused around comprehensive eye care services, and the report provides a definition of this, quite a long one at the moment. So there's three parts to this definition that I wanted to highlight: the continuum, the coordination, integration at different levels, and then throughout the life course. So the first part is around the different health strategies. So the continuum from promotion through to rehabilitation. We know that there are many health promotion efforts that do have a positive impact or can potentially have a positive impact on vision, but it's not something that's generally considered as an outcome or a variable, and yet we know that this is important. So we would like to see vision being considered more in general health outcome. Of course, there is the ongoing attention to sort of the disease prevention and what I mentioned before about those diseases that can be entirely prevented, the appropriate and timely diagnosis. And this is not just around, having a disease diagnosed. It's around the time at which that happens in terms of disease progression, and also making sure that the diagnosis is also particularly able to pick up comorbidities, those sorts of issues. And then, of course, the treatment and disease management, and what I was mentioning before, that rehabilitation, vision rehabilitation, should be considered an integral component of comprehensive eye care services. It is not an add-on or a nice to do. It is part of services. The second element of this definition is around the coordination and integration at all levels, and here we've got from community through to tertiary. What we have here is just indicative at this stage, because we know that it varies significantly between countries, and also this is likely to be one of the areas for sort of further and ongoing work. The key elements here, though, are that there's the referral services, and this has been a focus of community and primary eye care for many years, but it is an integral part of the delivery of effective comprehensive eye care services, and particularly trying to emphasize that it's comprehensive eye care services does not mean that every provider has to provide comprehensive services, but that when you put together all of the different components or elements, that they make up a whole, and that there are good referral systems between them. The final element there is around throughout the lifetime. So we know that there is obviously the close correlation between aging and vision impairment, and that is been a significant focus around the sort of the prevention and diagnosis and treatment efforts, and that needs to continue. We also know, however, that there's more that needs to be done around investing in areas of childhood blindness, and many people are now referring to the myopia epidemic, for example. Adulthood and the working age population. This is also an important area, given the impact that eye diseases and vision impairment have on this group, particularly when it comes to work and employment. And so we're trying to emphasise that it's not just looking at one group of people at one stage of life, but looking right across the life course there. And that is this section. So it presents a definition and it provides some description. This section is quite short at the moment, so we know that we have more work to do to expand on it. But I will pause there.
Maybe one quick question. There was earlier somebody who asked about, will the report kind of provide a clear guidance on how NGOs could better coordinate the work? But I would kind of like to expand that question a bit around looking at how you present comprehensive eye care at all levels, in all ages, across all health strategies, that definitely needs partnerships in many ways. So from government to other actors, NGOs and so on, different departments and so on. Will the report kind of cover the kind of need of partnerships and how to be able to make partnerships effective?
Yes, it will, and I think that's something that we probably need to expand on at the moment, because the chapter on comprehensive eye care services should sort of focus on what they are, and then the subsequent chapter around the drivers is around the how. So I think this is an area that we probably need to expand on, because the reality is that there are already many stakeholders who are involved, and in most places that will continue to be the case. And so there needs to be consideration for who is doing what, where, at what level, and how the services are coordinated and connected, particularly when we consider the patient journey, and also where there are services that are private or public as well.
Okay, talking about services, I think that was the perfect bridge to the next part, which is around essential packages of service.
Sure. So this particular one, this is in chapter 5. We're proposing that an essential package of eye care services should be developed. And the reason why we're proposing this is because we know, and many other stakeholders, we're talking about the importance of eye care being included in universal health coverage. But what does that look like in practice? Does it mean that countries need to provide everything to everyone in every possible situation, or does it mean something different? And from the WHO perspective, this is something that we're doing and have done in other areas as well, where we look at what is an essential or minimum package of services, what are the specific interventions that are required, what's the cost associated with those, what's required from the equipment, the consumables, the human resources side, and importantly the competencies aspect of that, and also not just the what's required, but what levels should they be delivered at, from the community to the tertiary level. And this very much encompasses the comprehensive eye care approach. The reason why we are proposing that this should be developed, and this essential package won't be in the report itself, because to develop it does take a bit more time. But the reason why we wanted to highlight this as an area of need is to ensure that when countries are going through the planning process for their services, looking at universal health coverage, that they're obviously setting the priorities, they're doing the planning, they're doing the costing, implementation and review of what those services would look like. And it's about how do we provide a package that they can use when they are going through the costing process at the national level. And this is something that it seems to be a real gap at the moment. And so when we're talking about this costing and this process, what does it look like at the national level? And an essential package of services essentially helps to fill a gap in terms of the data around what is safe, what is effective, what is required to reach disadvantaged groups, what is the range of diseases or conditions that should be addressed within an essential package of services. It also looks at what currently exists, such as the distribution of HR at the national level. An important part of this process, in terms of taking an essential package of services and then aiming to implement it, is looking at the dialogue. And so making sure that at the national level there's a multi-stakeholder discussion around the evidence and how things should be delivered. And this part is particularly important because we know that in some areas of health that sometimes it's the loudest or most common voices or issues that can advocate and receive services. And we know that particularly in eye care there are underserved groups, and we need to make sure that the decision-making processes are more cognizant of that particular voice. And then finally at the top here we have decisions. So at the end of the day, these are political decisions that are made by ministers and by governments. But by providing this essential package, we're hoping that it provides more robust data that can be used at the national level to support the dialogue and the discussion to then enable more informed decisions. And I'll pause there. Thank you.
Okay, thank you, Megan. I think in the absence of a specific question on that section, I just want to highlight that I think it's very good to kind of bring the universal health coverage focus in here. And that's really also a priority for the new Director General of WHO, Dr. Tedros. And we will have this year the World Health Day in May focusing on universal health coverage and also the World Health Assembly. So I think it's good to kind of align our work on eye health with that very strong kind of force that's being built up around universal health coverage. So there was already a question on timelines, and I think we are coming to the point now about when will the report be published, when will it be launched, and what are the next steps actually?
Sure. So, well, Fact Day this year, which is on the 11th of October, I think. So the report will be finished and will be ready for a global launch on this date. And obviously this is an important day for the eye care sector and the community, and we wanted to make sure that it's something that we didn't just release on any old day, something that where we would hopefully for all of us be able to get as much attention and effort on this particular issue. So what we have been doing is quite a bit of work to look at what does the launch look like, what's our communication strategy, how do we make sure that we reach all of those different stakeholders that we talked about earlier. And what we have here is just very briefly some initial options. So we're looking at what communications products we can develop, and these are essentially different ways of describing important parts of the report that resonate or will reach some of the different stakeholder groups. So firstly, we're looking at developing an executive summary or a short version of the report, something that has the key messages and the infographics in it. We know that if we get this right, this is likely to be the thing that the most people will refer to and use, and then being able to go to the full report when needed. We're also considering some form of a two-pager for decision makers, something that includes information that's relevant for them, particularly highlighting, for example, the economic case for investing in vision. And this is because I guess we're cognizant that the report is and should be an important advocacy tool, but it's not necessarily taking the full report along with you when you're meeting with something. And this is the sort of thing that's come up as a suggestion. And of course, social media and infographics. When it comes to the launch, we're looking at encouraging national launches and policy dialogues. And this is something that WHO has done with a number of other world reports, where there's almost a rolling schedule of launches that happen in particular countries. And the reason why we want to focus on the national launch and the policy dialogue is because this is where the work happens. This is where the decisions are made that matter the most in terms of the way that services are delivered. So what we're hoping is that as many countries as possible will agree to have a national launch, and it won't just be an event that launches the report, but we use that as a springboard for having a policy dialogue. So an opportunity for countries to look at what the report says, what the recommendations say, to have a multi-stakeholder discussion about where the country is up to, and aiming to sort of agree maybe one or two key actions that each country may take to support, work towards implementation of the recommendations in the report. In order to do this, we know that we would need to provide some form of a toolkit, including, a guideline for running an event, what sorts of stakeholders should be invited, what's the format, those sorts of things. Not to be prescriptive, but to provide something that countries can take and adapt as needed. It should also include, obviously, a PowerPoint and key messages, those sorts of things. Another area of work is obviously what all of this means for WHO more generally. We've talked about a couple of areas where we think further technical tools or products need to be developed, such as the essential package of services. And we're also looking at what else we need to do to really support countries and other stakeholders to work together to support the implementation of recommendations within this report. And that's it for the sort of next steps, and I can pause for questions there.
Yeah, thank you, Megan, for kind of laying out the launch and what's expected, and just also to assure you participating in this call that IAPP and WHO are closely working together on kind of how best to use the World Sight Day and the launch, and then national launches to bring the message of the World Report and the content really to decision makers. So if you want to participate or have ideas, please don't hesitate to contact us, and we will bring them into the dialogue. I think that's a great opportunity that we can really drive together to make the most out of it. So the next steps, Megan, are which ones?
Sure. So the report is available online, and the consultation period goes until the 23rd of March. So that's another couple of weeks, I think. So please do take the time to have a look through the report and to provide some feedback in the template or in track changes too, if this is what works best for people. And if there's we really do think this is a draft. If there's anything missing or suggestions that people have, please do let us know. Also, the bulletin of the WHO, that's our public health journal, they're doing a theme issue on vision. There's been a call for papers. The deadline's next Thursday, so it's a very short time away. But if you happen to have something that you think could be useful, or you've been thinking about publishing maybe some work that you've been doing, this might be a great opportunity. There are a range of different papers that can be submitted to the bulletin, including, lessons from the field, I think they call it, which is focusing on maybe the experience in a particular country or in a particular community. So please do have a look at that if you think you've got something to submit. And other than that, there's my email address there. So please don't hesitate to contact me with any queries or suggestions at any time.
Yeah, thank you very much. As you said, the papers that can be submitted for the WHO bulletin, there is a kind of whole set on what type of papers and how long they can be and so on. And you find it on the web link that's provided here, but there's also some blogs on the IPP webpage that you can find. Other than what the next steps are here around the World Site Day and the launch, and when there's toolkits available and the branding and messaging, this is something that's being developed over the next weeks. I think we cannot give an exact date now, but there will definitely, that will come in time and be sent out via many channels, so that you have in time the information that makes it possible for you to use things for the World Site Day. So I thank you very much, Megan, for running us through that and being very responsive and open to all kinds of questions, and also for sharing your email. I hope you're not ending up with hundreds of emails in the next 2 days to be answered, but it's great to have the opportunity. So big thank you to you. Thank you also to all the audience and the attendees for joining at different time zones and being so active in participation. They said if there's follow-up questions, don't hesitate to get back to Megan or to me or any other person at IAPP. As said, all your questions and comments stay available, and we will have a proper look at them to make sure they are considered and addressed. You can, if you haven't managed to download the PowerPoint presentation, we will make a link or the PowerPoint available via email. And looking forward also for your feedback to the first draft of the World Report, which is due by 23rd of March. And from IAPP side, we will keep you updated on the development of the World Report and the next steps taken over the next couple of weeks and months. Thank you very much, and wish you a good lunch, evening, or night, depending on where you are. Thank you.
And thank you very much.